and welcome back to the next episode of Back in a Mill. This is our first episode of 2025 and I'm joined today by Dr. Keiron Lord. Hi Keiron.
Hi, thanks for having me. I'm glad to be here and I'm excited to be the first guest of the new year.
I know, how exciting. First guest of 2025. So I really want to kickstart today by asking you about your background. So obviously, previous background for you, obstetrician, gynecologist, now very much involved in aesthetics. What kind of brought you into aesthetics from this world of obviously your prior medical history?
Yeah, so I won't lie and pretend that this was kind of always a big dream or the end goal or going to be in the aesthetics game, and that was that. I actually started, as I think a lot of people do, early on. I was a junior doctor 10 years ago or so, and actually it just started because friends and family members were having treatments done, and I started to think, well, I could do that treatment, and you can pay me instead. And that's literally how it started. And I started doing that, like I said, about 10 years ago. I'd then see their results and see that they were happy with them, and then they start recommending me to friends. So I started a very small business. And again, being completely honest, at that time it was purely a financial thing, actually. It was kind of, I could do a 12-hour night shift in A&E, or I could go and do this clinic. But it wasn't until after kind of you start to see people coming back and they're referring you to other people, or other people to you, other people to you, and you realise that actually they're really happy with the results. They give them really a lot more confidence, and you start to think, well, actually, I can make a big difference to the way people feel about themselves. And that's how it started. So it was purely almost accidental in that it became I think, but it just developed into something. And then since then, I've just kind of been building it more and more. And yeah, it's just become kind of the main thing I do now.
So how is the reward kind of different then? Obviously, because you was at medical school for 4 years. Yeah. So how is the reward from aesthetics kind of different to what you do with your gynecology, for example? How does that seem and feel different for you?
So I still do the obstetrics and gynecology work. I still do it a lot less than I used to, but I still do it, and I'll always do that. That's still a really important part of my life. And I don't think there's, as much as you get the buzz from the aesthetics industry, I love running the business, I love seeing clients, I love seeing the results they get. You still get, the adrenaline rush of running around labour ward. That works.
All those screaming women.
But the buzz, I think, for me from the aesthetics comes from being able to do something and do it well. I think in this industry as well, there are a lot of people out there doing it and maybe not doing it as well as they possibly should be. And I think being able to do something well, really listen to your clients or your patients, what they want, deliver what they've asked for, and then they come back to you afterwards and go, that's literally changed my life. People who have been self-conscious about the nose for years and years and years, or people who won't go on a Teams call. That was a big thing after COVID. Terrified of putting the camera on for a work meeting because they've got dark circles under their eyes. And actually,
you don't realise, do you?
Yeah. You think it's something quite minor, but actually you can make that small difference to them in a half-an-hour appointment, and it can literally change lives. And for me, that's the bit that I really like. Also, I'm a little bit of a geek for the sciencey stuff, so I quite like the science-backed treatments, and I like that evidence base and things like that.
Okay, that's really interesting. So for me, it feels like you get a lot of reward from making people feel better, and you've really enjoyed that, which is why you've kind of gone more into aesthetic medicine as of late. Which treatments do you feel in 2025 are really up and coming for aesthetics?
So I think there's going to be a few trends in 2025, and I think probably for the better, really. I think for a start, everyone's moving towards more regenerative treatments. So I think in the past it's been very much fillers, toxins, and I think they'll always have a place. But I think more things like the polynucleotides, your exosomes, anything that kind of banks collagen. I think people are starting to realise that you can put all the fillers you want into somebody, but unless you're creating and storing collagen, your skin quality still deteriorates. So I think polynucleotides are a massive one because they really do change the way your skin looks and feels. Exosomes are going to be game changing, much less invasive as well. So microneedling essentially rather than treating with needles. I do still think, however, there's going to be a place for fillers and toxins. I know there's a lot of people out there going, oh no, people are having all their fillers dissolved. I don't actually think these celebrities generally are having all the fillers dissolved. I think they're having the bad fillers dissolved and having small amounts of well-placed filler put back.
Yes, and it makes that result a lot more proportionate, right? And I think this is perhaps where the industry has gone a little bit too crazy with fillers and with your Botox, because they've actually missed a lot of the skin factors, I believe. And I think that's what's led to a lot of like pillow face, because people are trying to resolve their faces and feel better, but actually they're just filling rather than going, okay, let's take a step back and look at what can actually help the collagen for the skin. And I think that's probably what's not been maybe educating with the clients so much, particularly amongst practitioners, you know, anyone that's in the industry.
I think it works both ways. So I had a client who came in not long ago who had 2 treatments of Profilo done elsewhere, and her daughter actually comes to me for some treatments and said, will you just see my mum, because she's had this, she's contacted the practitioner, they've said, oh, come in and have a third if you're not very happy and see if that makes a difference. And she wanted my opinion, so I said, yeah, bring her in. And Profilo is a great treatment. Any skin booster are a great treatment. Everyone would benefit from a skin booster, no matter what treatment they're having. A skin booster will always make
I
it
say
better.
this to my clients as well.
But what they'd missed with her, she'd never had anything done. She was probably in her 60s, and she'd had a lot of volume loss in the mid-face. Profilo is just going to make your skin look a bit better. It isn't going to replace that volume. And actually, you know, I said, you kind of need to think about a little bit of filler, and then you could think about the Profilo, or the other way around. And I think it's because you've got to think about the structural element of the tissues. So you've got to put that structure back so that, you know, it's you've lost volume in them fat pads in the mid-face. Unless you revolumize the fat pads, that volume isn't coming back. You need to put the volume back. Once you've lifted the skin and lifted the tissues, adding the Profilo or whichever skin booster is only going to make it better. But on its own, it doesn't work. And the same the other way around. Like you said, fillers on their own won't work either. It's this combination approach.
And I think that's definitely what we're trying to push, especially in the new year with them being so popular now as well. I'm really interested to kind of know then, with you being so medical and you've been very much involved in the medical background, how your colleagues kind of view the fact that you're doing your aesthetics as well so much now, more than ever, as well as that as well. How do they find that? What do those conversations look like?
To be honest, they're all really supportive of it. If anything, they are the ones who are saying to me, why are you still here? Why are you still coming doing this night shift? I just did a 12-hour shift on Sunday on labour ward up in Warrington Hospital. And yeah, people, why are you not doing full-time aesthetics? Why don't you go and do a full-time aesthetics? So I think the NHS role will always be, or it will always be, something I want to do. It's what I trained to do, and it's something I really enjoy. The easy option would be to say, well, actually, yeah, let's get rid of those long 12-hour shifts. Let's get rid of the night shifts, and let's just do the aesthetics full time. But I like the balance I've got at the moment.
Yeah, because you've got a little bit of everything going off. What does your 12-hour shift look like when you're there in the maternity ward?
Yeah. So mostly at the moment it's maternity ward and a bit of acute gynecology. So essentially it's looking after the women who are in labour, looking after anybody who comes into A&E with acute gynae or acute issues relating to pregnancy. It's busy. As everywhere in the NHS at the moment, it's a little bit, everywhere's understaffed, everyone's overstretched. But it's always rewarding to come home. When you come home, you always feel like you've done a good job. And I actually think this balance between the aesthetics and the NHS role I've got now helps me do both well. I think when I was doing NHS full time, I'd feel myself burning out.
A bit overwhelming.
And when I was doing, if I do more aesthetics, because you're thinking I've got a clinic there, order my stock, do this, that can cause a bit of burnout as well. So it's quite nice to have
It's finding that balance, isn't it?
Yeah.
And how do you feel like the medical industry has been pressured by a lot of doctors, as we know, that do leave the NHS to go into the aesthetics industry? How do you see that? Because you're very first hand with this. So what would your opinion be on that?
Yeah, I think everyone can make their own decision on where they want to go with it. I think the issues in the NHS are multifactorial. I don't think it's just about people leaving and going abroad or going into private sectors and things. But the majority of my colleagues, I believe, do still work in the NHS, and a lot of people I know still do aesthetics as part-time, but still do their NHS role because they enjoy it. And I think there's something to be said for kind of making the work environment in the NHS more supportive, so people are wanting to stay. I mean, for example, right, so you question why people leave and you go, well, the work's rubbish and the work, but you don't do it for the money, and that's the thing that will get thrown at you. It's a vocation, which absolutely it is. Right? Nobody does the NHS jobs for the money. I've had people say to me before, as I've said, why are you still doing it? Why don't you do aesthetics full time? I've had people advise me to not post things about my NHS job on my Instagram page for my business.
Really?
Because it might look like my aesthetics business isn't doing very well, and I'm doing the NHS job to make money. I was like, honest to God, like,
it's the opposite.
I'm not making money. Like, the NHS is not where I'm making money. The problem with it is, if you look at the way they pay people in the NHS, right, and there was all this junior doctor strikes and things, because I think the media puts it across that doctors earn a lot of money.
Definitely.
So I worked out once on a shift I was on. So I'm sort of a fairly senior doctor in the NHS, out of hour. Well, when I'm on labour ward, I'm in charge of labour ward. If somebody needs to go for an emergency caesarean section, or needs to go to gynae theatre for an ectopic pregnancy or something life-threatening, then I'm the one doing that. I'm the only one in the hospital who can do that operation.
Wow.
So if I'm not saying that as an impressive, I'm saying that because I want to set the scene so you can work out. I'm going to ask you a question in a second. So I worked out my hourly rate and worked out how much I get paid for doing an emergency caesarean section based on my hourly rate. So say, for example, I'm in on a Saturday night, my emergency buzzer goes off at 3 a.m. I run into a room, baby's heart rate's next to nothing, needs to go for an emergency category 1 section, which is life-threatening section, caesarean section under general anaesthetic. I do the operation, get the baby out in a minute or so, paediatric team are there to resuscitate, and then I finish the operation. How much do you think I get paid, just me, not the rest of the team, but just me, to do that operation?
I would think you would get paid thousands to do that operation.
Works out about £15.
Stop it.
If you work out my hourly rate,
No, it does not.
it works out £15 for an operation. I've got a junior doctor with me who will be on about 12.
Wow.
I've got an anaesthetist colleague who's the one who's essentially keeping them alive while I'm operating.
They'll
be on about the same as me.
To actually perform a life-saving.
So you're getting all 3 doctors doing that operation, the 2 surgeons and the anaesthetist, for less than 50 quid.
Wow.
So,
and then they kind of wonder why more doctors and medical professionals are moving into the aesthetics industry.
Yeah.
That's
now,
crazy.
It's absolutely,
that shocked me.
Yeah, it's absolutely not about the money. That's not why you do it. And I still do it, and it's because I enjoy it. I go in and actually look forward to the shifts. It's not about the money, but you've got to think about these people who've done X amount of years training. I work at the Nottingham Medical School and train the students there. They've done 5 years. They've spent £100,000 plus on student fees. They're never going to see that money back. And actually, you think, well, even if you think they should all be working in A&E and cutting down waiting lists and things like that, you have to sympathise a little bit and go, actually, I can see why they're going to Australia. I can see why they're going into the aesthetics industry, because they should be valued, they should be paid for what they're doing.
Absolutely. So I would say, based on that, then it's a real common misconception, actually, that the doctors are being paid, a lot of money for what they're actually doing. And that does explain why doctors are looking more towards going into aesthetic treatments, because it's a nice sideline, isn't it, for them to go, and like you said, they're going to medical school for years and they're not getting the recognition that they actually deserve.
No,
it's just crazy.
Yeah. And I think now more doctors are going into it, and nurses especially, because I've complained about doctors' salary, but nurses and midwives are on significantly less than that. They're giving up, if you're a newly qualified midwife, you're on low £20,000 a year. For that, you're giving up Christmases with your family, birthdays, nights, and all the rest of it. It's no wonder they're going into that.
And it's a lot of mental pressure, right?
Yeah. And I think maybe, now as well, things are expanding more. You've got more of the longevity side coming into aesthetics, and the managing menopause coming into aesthetics and things like that. And I think that's perfect for people like that who want to still have some involvement in healthcare and promoting healthcare and promoting healthy living. It's really working well for them. So I think more and more will.
I saw that, was it Dr. Tim Pierce? He's doing a lot of longevity stuff at the minute, isn't he? Did you see that?
Yeah, he was one of the first ones to start with that, I think. And I think a lot of places are. I've started incorporating it into my clinics as well. And I think everyone can. You don't have to be a prescriber. So if you're a prescriber, it's great, because so for my clinics, especially with my gynae background, I do a lot of perimenopause, menopause management. So I do hormone replacement for menopause, hormone replacement for andropause, weight management. Wow. So all that does usually require prescriptions of medications. But actually, there's a whole field of longevity medicine which isn't about prescribing. It's about health optimization. So your biohacking techniques, so your cold showers, ice baths, saunas, getting your steps in, all the rest of it. Daylight, if you get any daylight. Getting daylight into your eyes first thing in the morning.
We don't get any daylight in this country.
No.
Definitely no sun.
No, I did do a reel about that recently. I was like, 3 easy biohacking habits. Like, have a cold shower. It's like -8 outside. I'm not having a cold shower.
Yeah.
Oh, look at direct sunlight for 10 minutes when you wake up. It's like, so, yeah, it's hard to do. But there's things like that. And I think everyone's going to start incorporating that, because you think we've got a perfect catchment group. You've got a lot of clients, not all, but many clients are that sort of perimenopausal, menopausal age. And actually helping them out with that will help them feel and look better. Things like, which I hadn't realised, was things like some aesthetic treatments, like PRP treatments. Do you do them here?
Yeah, we do them here, yeah.
So somebody can have PRP treatment and it'll improve the skin, and because it gets all the nice good factors out of the blood and the healthy bits out of the blood, put them onto the skin, it improves it. But if you're then having 4 takeaways a week and you're drinking excessive
it's
every
the balance
weekend,
of that lifestyle.
the PRP isn't going to work. So that's why the longevity bit is coming in. And I think it's really right. It should do.
Yeah, definitely. And I think this again is a little bit of lack of understanding with clients. Sometimes they will come in, have treatments done. There was a little bit, not so much now, but a few years ago when kind of Molly May had all the fillers and everything and the huge kind of bulky jawline, bless her. It was such a misconception that if you had jawline filler, you'd look so slim. And, I think that's changing now, and it's nice to actually see, because before there was so many just wrong information, and people would think, oh yeah, like I can have 4 mils of filler in my jaw and I'm going to look really skinny. But no, it's not about that.
No, it happens a lot. And I think it's misinformation online. I think
there's a lot of,
I think people also just don't know when to say no to the not the clients necessarily. They don't know they've come into you for advice. They don't know what they need,
and they're trusting you to be able to give that advice.
Yeah. And I think it's important. One thing that for any practitioner, I guess, it's important to one, know when to say no, and to two, when to say that actually your treatment isn't going to do what they want. I think I always find necks are quite a difficult area to treat.
Yeah.
And they come in, I want this lifted and all that. I say, look, there's not a great deal I can do to lift that. We can improve the skin quality, get a bit of collagen in there, tighten it. We maybe think about a bit of cheek filler, a bit of jaw filler to help lift and define naturally.
Yeah.
It's not going to lift too much. It's probably just going to take the eye away. If we sharpen your jaw, it looks less noticeable. But ultimately, you need to be able to say to your clients, if what you're wanting is that really tight neck, you probably have to go and think about theatre.
Yeah,
and get
I think it's
approach.
Them knowing the difference between non-surgical and its limitations, and actually how you can combine that maybe with a surgical treatment. How many clients do you get, Keiron, that come in and lift their whole face up like this?
Yeah.
No, they literally get their whole face and they pull it back, and you're like, okay, we need to slightly lower the expectation.
Somebody actually accosted me yesterday in Morrison's. So I've messaged you. I need you, and exactly that. I need this.
You're just trying to do your shopping.
I said it's all right, but I said I'm sorry I didn't get back to you. I was working yesterday. Come and see me on Friday.
My gosh.
Exactly this. It's kind of like this.
Yeah.
This lift, and you know what? You can achieve. There's this idea. Oh, fillers don't lift. I genuinely think fillers can lift if you use them right.
if you put them in the right place.
I do think fillers lift to a certain amount, but it depends what the end result is, and I think that's it. People don't, and they go, oh, that cheek filler didn't work, let's put another mil in, see if that works. It hasn't.
And not everyone responds the same. Some ladies respond better than others. How have you got on with polynucleotides on the neck?
I think they're really good. I really like them. So I used to use some I've tried all sorts of things in the past before polynucleotides were a thing, but I think they work really well. And I think maybe, I don't know what other people think about this or what you think about this, but I think I've had people who had skin boosters, face and neck. And now I've said, actually, I think skin boosters for your face, absolutely carry on. For your neck, I'm starting to move away from that now and saying, look, I think polynucleotides would be better.
Yeah, so I don't offer skin boosters for the neck anymore, but the polynucleotides are a lot stronger. So I think for the neck, it's an area, especially for women, that tends to get loose quite quick. So I think that's like a problem area for ladies. But I've treated a lot of necks, especially for my clients that are in Spain, actually. And they tend to have slightly worse necks because they're in the sun a lot more than my UK-based clients. And I definitely noticed the difference. And they've had some amazing results. 2 to 3 sessions of polynucleotides on the neck. It's amazing.
It's that's it. With the face, it's more the skin booster. You can use polynucleotides, obviously, in the face for crepey skin and stuff. But skin boosters in the face are for that hydration, that glowy, that dewy look.
Yeah.
Your neck, it's not that you want your neck to be glowing and dewy.
Dewy.
it's the lines that you get.
Yes.
Either just from
lines.
being on your phone or from on laptops or sun damage, things like that. And by injecting the polynucleotides there, you can see that actually, you know, you're going to improve collagen, you're going to slightly improve elastin, you're going to improve blood flow to the area, you're going to just promote regeneration of those tissues, and actually you're going to get a much better result by using the polynucleotides in that area. And that's something I think is important to kind of, again, educate your patients and clients about and say, I know you want that treatment, but what about this? Think about this. This might be better for you.
Yeah, definitely. I agree. So with the rise of non-medics doing aesthetic treatments, as a doctor, what is your opinion on this kind of whole medic, non-medic battle that seems to be ever increasing? There's been some controversial posts being made lately on socials. I won't say who, everyone knows. But yeah, how do you sit with that?
Yeah, I try and stay out of that. I haven't commented on a single one of those posts. I was very tempted at one point.
It was tempting.
But I didn't, because I want to stay out. But yeah, I've made it very clear for years I've never had an issue with non-medics carrying out aesthetic treatments. I don't think there's a question about whether I don't understand the justification necessarily for it being just medics. I know other countries have that, and I think, you know, I will defend the medic side and say, actually, I do think, and this might not be what people want to hear, I do think certain things being a medic gives you advantages for. So things like you've got I did 3 years of undergrad degree, 4 years of medical degree, where throughout that I've done anatomy, physiology, pharmacology training. I've then done 10 years in the NHS, 8 of those as a surgeon. I've done my postgraduate surgical exams. I'd like to think my knowledge of anatomy, physiology and pharmacology is slightly higher than the majority of people who've done even higher level 3, 4, 5, whatever, anatomy, physiology. That's not to say that's not to sort of say that that's a bad thing. It's just
no, that makes sense. That's just facts.
But when I'm at med school, I've never been taught how to inject Botox. Generally, doctors don't inject medications or give treatments. There's certain ones I do now, the higher risk ones, but most of the time it's the nurses who actually give the medication.
Yes. So you're not so much administrating as a doctor.
Prescribe. So I think there is an advantage to it to some extent, but I think it all comes down to the fact that this debate goes on because I think there's just poor regulation in the industry, and the number one thing that causes the issues, I believe anyway, is the training. I think we can argue all we like about regulation for, it should only be doctors, it should only be nurses, we need to do this, you need to have a level 7, whatever. I don't think that matters. I think we standardise the training and make the training the same for everybody. Because if you look at the training, when I work in the NHS or when I teach the medical schools medical students at Nottingham, say I've got a final year medical student, they're going to hit the wards in August. They can't just go out and start taking bloods on people. They need to do a certain number of blood tests during their training. They have to be observed by multiple different people, so they can't be signed off by the same person, and they have to be on different days. It can't all be, I've got this F1 doctor who's going to sign me off for 7 bloods and now I can do them, I'm competent. They have to do a certain number of them. When I first started operating on people, I had to do a certain number of operations under direct supervision before I was ever let loose on my own. But in the aesthetics industry, when I started my own academy last year, and you'll have known this as well, I've gone out and tried to find out. I said, okay, how many Botox treatments does this person need to do before I can sign them off? No, it doesn't matter. What do you mean it doesn't matter? Like, do they have to do one patient, 7, 10, 12? Doesn't matter, just until you're happy.
They can't give you an indication.
No. And I know of one place, which I obviously won't mention, but somebody who came to me and had been there, and basically I think they'd gone there as a model and said there was her and there was 4 students who all did a quarter of a lip each. And you kind of go, well, that's
shocking, isn't it?
That's not training.
It's
it's
not
just
training.
somebody stood there
You can't go
going,
out and competently inject
no,
anything with a quarter of a lip. But I see it all the time. And actually, they never really get anywhere because they get signed off from these poor training academies. They go on their own and they get that anxious that they can't actually do it, and they end up spending more money retraining because they've been signed off where actually they never should have been signed off in the first place. But you're completely right. You should never be allowed to do anything in any industry. This doesn't happen actually in any other industry where you're not measured against a learning aim that's standardized and that hits minimum requirements. It's
I think
crazy.
I think that's where it needs to be changed.
I think this is why the UK has a bad reputation for this industry because of this.
It needs to. The training needs to be the regulated bit, and you're completely right about the there's no kind of long-term thing. I've had people call me. You must have them as well here. They ring up. Oh, I did this training somewhere. I had a girl the other few months ago. I've done this training and I've spent thousands, and it was a 3-day access course and all this. I was like, I don't know what I'm doing. I've done one lot of lips in that entire thing, and I don't know what I'm doing. And then they either end up exactly as you say, they pay to completely retrain. She was looking at coming doing a shadowing day, and they're the good ones actually. How many do you think actually do that? How many do you think just go, oh, I'll just go and have a go? And I think there's something to be said about that. And the other thing is when you then contact, and this happens a lot as well, and this is what this girl was telling me, once you've done your training, you contact that place back and say, I did this course with you, I just don't feel confident, I need a bit more time. Because you're then trained and probably working in a similar location to them, because that's why you've chose that for training a lot of the time, they then view you as competition, and then they're less willing to help you. I've had people back and I've done shadowing days with them, because I just think I'd rather keep mentoring them until they're good.
But that's the difference between someone who wants to teach someone something with the safety of the public and the difference between someone that doesn't. And I think for the trainers academies, because the students are paying up front in many occasions, they see it as more work. Oh, I have to spend more time with them. I have to put them on another group. It's more models, more work. And they just don't want to put that work in. No. They just want to earn quick money, send them on the way, and it's not their problem anymore. Same with the big classes, isn't it? You've got big class size and one instructor. It's not going to work. You need to have one-on-one, 2-to-1, something like that. We don't allow any more than 4 in a group, and that's very strict, preferably 3, because they get more of that one-on-one time, and we always have 2 teachers at once. We never just have one teacher.
That's it. We always train. We have one. If I do it, it's either 1-to-1 or it's 1 to 2 students maximum.
Correct, yes, because you can never be fully watching what everyone's doing if you don't have that set up. And can you imagine if you're training students, and they're injecting and you can't see what they're doing because you're busy with another?
If it's purely from a financial point of view, why would you not have 8 in your class? Because you'll get twice as much money.
Scary, isn't it? But I've been on these courses myself, and I've turned up and there's way too many people there, and I'm like, this is exactly how an academy should not be run.
I've done it once years and years ago, and I ended up retraining. It was a skin booster polynucleotide type course. A friend of mine booked it, and I didn't look at it. I said, yeah, of course.
You learned from that. You were like, gonna
first
check
of all,
the next
sat
time.
there, and there was 4 of us, and there was me. It was only 4. That was fine. There was 2 trainers, absolutely fine. And it was me, friend of mine who was a midwife, somebody else, I can't remember what they did, and they went to the final person and said, okay, can you introduce yourself? What's your background in the industry? What have you been doing? And she goes, oh, well, actually, this is my first course. She was like, actually, I'm a chicken farmer. what is going on here? What is this course? But I just ended up retraining in that because it was just terrible.
No, it's crazy. We actually had a case this week, just a few days ago, and it was actually a client of mine who had moved to another city, and she'd gone and had some lip fillers done with another girl where she was living. I'm not sure who this girl actually was, who she went to, but she was non-medic, and her lips, they were destroyed. And I said to her, she sent me the pictures, and they were so bruised that they were just completely black, but everywhere. And I said to her, these are the warning signs. These are things that you need to look out for. Within 2 hours, she texted me and said, my lips feel freezing cold. I actually rang the aesthetics practitioners for her because she was very upset. I said, your client is ringing me. They can't get hold of you, not being responsive. She has freezing cold lips. She's covered in... Well, she says, what do you want me to do? I says, well, do you think you need to perform an emergency dissolve?
Yeah.
She's like, but it's just bruising. And I'm like, no, it's not. Her lips are freezing cold, which obviously, as we know, is more sign toward a vascular occlusion. It's crazy.
That's the other thing with the training, isn't it? Surely for everybody, because actually, again, medics don't necessarily know. People have been turning up at A&Es with occlusions.
I was going to ask you this.
Getting better, but they're often having people going in training the medics in A&E signs of an occlusion because it's not something you see all the time. You see it in legs and stuff.
Do A&E hold
I think some
Highleys?
do, and I think if you ever get, that's a thing, if people ever feel they've got an occlusion and have to go to A&E, or the practitioner recommends that they go to A&E, first line is always obviously going to be go to your practitioner. But if you can't get your practitioner or you have to go to A&E, you want to look for an A&E with a plastic surgery department ideally.
Right.
Because those with the plastic surgery department will be more equipped to do it and will more than likely stop the Highleys.
Okay.
But the doctors don't see it all the time. So I think it's people. I feel like whether you're a medic or a non-medic, when you're training, a mandatory and regulated part of that training should be that complications management. Because people don't know. I had somebody, friend of a friend. So somebody I know is a really good practitioner up in Manchester, who's a non-medic. She trained somebody in everything else except she hadn't trained them in nose filler. She doesn't do nose filler either. And but the girl had messaged and said, "Can you help me out? I've done this nose filler, and this is looking like this." And anyway, this girl asked me to give my opinion, and I said, it is looking like she needs to dissolve. And she'd already done a dissolve, I think, and tried a second dissolve. Anyway, I went back into clinic the next day, and this girl says to me, I've spoke to her again. She said the client's not going to come back in for a third dissolve because she said it looks like it's getting better now because it's less painful. So that's not, you see the picture, you could see
the pulsates.
I said it's not less painful because it's getting better. It's less painful because you're killing the nerves now.
Yeah.
Like you really need to get that dissolved. And at the time I didn't have my ultrasound machine, so I just said go and get a
It's hard, isn't it, without ultrasound, because you have to be able to pinpoint where that occlusion's coming from. And I think with the nose being the highest risk area, apart from obviously the bum, I think that with the nose you do tend to see the most complications, and the client won't necessarily know what that should look like or feel like. Like you said, we know that kind of loss of that feeling is a bad sign, but it's about making sure that the client knows, and that the practitioners and the doctors are actually passing that on to the client so that they know what to look for when they're at home.
And that's it. In this case, I think the practitioner wasn't aware. I think the practitioner genuinely felt that pain's getting better, therefore it must be improving. And again, that's what it comes down to the training. That doesn't matter whether you're a doctor or a non-doctor. It just, it's about training. These are the signs to watch out for. This is how it will progress. If it's getting worse, this will happen. So yeah, it just brings us back to the training again, doesn't it?
Absolutely, it does. So your website mentions that you are a natural injector. You like to perform natural enhancements. Why is this philosophy important to you, and why do you prefer to push forward natural results?
So I've always done that. Since I started, I've never been interested in kind of the big fake lips, exaggerated cheeks, really, really angular, sharp jaw lines which don't look real. I think the whole point of aesthetics is about making people look better but not changing the way they look, so maybe just turning things back and making them look how they did 10 years ago. Whereas I think a lot of places it's going too odd, and there's a very fine line between sort of aesthetics and then you're getting over towards the body dysmorphia type thing, aren't you? And I think a lot of the time you look on social media and those lines have been blurred. The biggest compliment I find I get, and I think you'll agree, and most practitioners, the best compliment you can get is when people say, I've done somebody's cheeks or whatever, and they go, I was out the other week at this event and nobody knew what I'd done. They didn't say, oh, look, you've had your cheeks done. They said, oh, you look good. Have you been doing something different? Have you been away? You look healthy. What's different? Have you? And that's it. You want people to look and say, you look better, but I don't know why.
And they can't actually spot what it is. Yeah, that's when you know you've done a great job, right?
Yeah. So all the regenerative stuff now, the polynucleotides, the exosomes kind of fit in with that because it doesn't change the way you look. It'll just turn back the clock a little bit. My kind of, I just don't get. I had somebody message wanting 2 mil of filler in the lips, and I said no. Like, I never heard back actually because I said no and said come for a mil. I'll review in a month and see if you need a second, but I never heard back. But I don't get it. I think there's this, your results should be natural so that when people look at you, they go, oh, you've got nice lips, not you've got fake lips.
Yeah, I agree. And this is my philosophy too. I think we should still look like ourselves, just an improved version. And I think people can lose sight of that. How do you, following on from this question, how would you deal with a patient, if you had a patient in clinic and you felt like they were displaying signs of body dysmorphia and they were asking you for things that you felt didn't sit well with you?
I had it actually. I had it once very early on when I very first started out. And I won't go into the details of the patient or anything like that or what they had done, but I anyway found out that they were having certain treatments done by me, and I would kind of stop, you don't need any more at this point. Come back and see me in 6 months. But I found that they were going around different places in the area getting different bits done and just cycling around because that's how they were getting away with it. And they came into the place I'd worked when I wasn't there one day and asked if I was in because they'd had these fillers in the cheeks this time, and they'd started getting sort of numbness and tingling, and I never saw them, so I can only assume it's just through stretching and damage to the nerve from so much filler. And at that point, I just had to be like, look, I can't treat this person anymore. You can tell them it's not what they need; it's too much for them, but it's hard, and I think it's the responsibility of any practitioner. You can spot it. Anyone can spot it. You think they don't need it, say they don't need it.
And what advice would you give to practitioners watching this episode that might be struggling to know how to actually approach their client with this? Because I find a lot of practitioners come to me and they're almost scared to tell them, or they don't quite know how to articulate it in a way that sounds, like they're not being mean. What advice would you give to those practitioners that are struggling to know what to actually say to the client?
I think any communication with your clients, it just has to be honest and like you tell a friend, this. I think if you have any more filler, you're going to start to look a bit odd. Like, you're not going to look natural. You look good as you are now. If you start putting too much filler in your cheeks, you're going to get that cat-like appearance. It's going to look odd. And I also think people tend to, if you see people who have work done and they've had too much, I think it ages them. I think they end up looking
older
because you look at them, your brain goes, oh, they've had work done, oh, they must be older than they look. So you automatically assume they're older. I think just saying things like that to clients,
and it's making them realise that it can have the opposite effect to what they're actually trying to achieve. But I have worked with clients in the past, they can't see it.
No. And the thing is that it's a psychological disorder. It is an actual psychological disorder, and it might not be something that as a aesthetic practitioner, whether you're medically trained or not, you can deal with completely. But it's not your role in that situation to deal with the big psychological issues that are going on. You're not equipped to do that. That's not your role. But it is important that you're ethical and say, I've acknowledged this. I think actually you're taking this a bit far. You do not need this. I think the real and ethical thing to do is just do it anyway. Yeah.
So just being honest, direct with your client, and just kind of letting them take that how they want, because at the end of the day, your name is going to be attached to that work, and the client isn't going to feel any better after that treatment, hence why they're having multiple treatments anyway, because it's usually to cover up or to mask another issue that they have going on. It's not necessarily that they want their cheeks doing or anything like that. It can just be something completely separate.
Yeah. I have another thing about people having excessive fillers and excessive work done, and this is purely my own theory. This isn't based on anything other than what I think. So I feel like so all these fillers and things, it started as a celebrity thing, didn't it? Celebrities, and then it becomes sort of associated with this celeb status that people are having fillers and Botox and whatever done. And if you look at the ones that we all look at and think they've had really good work done, so things like Michelle Keegan, right, had great aesthetics work done. If you saw her now, just first time ever you'd seen her, you'd never think she'd had work done. If you look at her pictures from 10, 12, 15 years ago and then look now, you can tell she has.
Yeah.
But that's good aesthetics. You couldn't tell
That's
that she
what
hadn't done.
Yeah.
But I think, and this is the theory bit I've got going on, which is just in my own head, is that I think people associate having work done and fillers done and Botox done with that celebrity status. And so in order to kind of portray that status themselves, they'll have lips done and they want them to look like they've done. Because they want to look like they've had lip fillers done because that's what the celebrities are having done.
Yeah, and that gives them the status.
Yeah,
Yeah, it's a bit like with the BBLs, when the BBLs went crazy with Kardashians. Everyone was walking around with giant asses and it looked ridiculous. But then as soon as Kim and Khloe took away their big bums, you know, now what?
And this once you, if you look at these people and you go, actually, the only reason you know people like Michelle Keegan have had work done is because you get photographed in the public eye. Otherwise, you'd never know, and that's
you'd
what
never
you want.
know, and that's what good work's about.
But I think people want that, so they go, I want to look like I've had my lips done.
Yeah, it's crazy. Very psychological, isn't it? So with your patient pre-consultations, aftercare, how do you usually manage that?
Yeah, so I think with any of my patients, any of my clients who come in, I've always been the same. I'm not. I can't do this thing that, you know, certain people you'll heard of in different clinics where they have the same spiel that they give to everybody, and they walk in the room and, oh, aren't you beautiful? How old are you? And it's the same thing. And I had two the other day. Well, one client the other day said she'd been somewhere with a friend and they both went in. The woman said the exact same thing to them both, and it's just very artificial and odd.
Yeah, it's just very fake, isn't it?
Just be normal with people. I think I get away with. I think I'm okay with it with clients and things, and even in the hospital, because I'm a normal, down to earth person, who I'm not some snooty person, and I don't speak in probably because I don't really know them. I don't speak in big technical words and things like that. I think it's about just speaking to somebody on a normal level and being able to explain things to people on a normal level. When I see my clients, I've seen some of them. They've been coming to me since day one, and I really like that I kind of just have a chat with them. They come in, we have a chat, we have a laugh, we have a gossip, we do a bit of aesthetics in the meantime, and they leave feeling good. I leave feeling good. We work on our own a lot of the time, don't we, in a little clinic room? So to actually get on with your friends, your clients like a friend,
it's nice.
Is really nice.
So you have a really personalised approach, I would say.
Yeah, and I like that. And it probably doesn't work for everyone. Some people want to go in and they want that doctor. I'm Dr. So-and-so. I mean, my Instagram and my brand is Dr. Lord, but like even now when people like, oh, Dr. Lord, it feels awkward. In the hospital when you're operating, they write Mr. Lord on the board and you're like, ooh. Like it still doesn't feel right. In clinic I'm Keiron, in the hospital I'm Keiron. Because I think some people want it. It's not for me. And I think also when people explain things, when you're explaining things to your clients and saying this is what I think you need and this is why, being able to explain that stuff in a language that people understand, you know, adding big fancy words doesn't make you look clever. It just highlights that you're a bit confused and you don't really know what you're explaining. If you know something well enough, you can explain it in a language that anyone can understand, whether that's your client, whether that's your student, or whether that's another practitioner.
That's so true. And I bet you have amazing client retention.
Yeah, most of my clients have been coming back since the start. And yeah, I get on with them all. There's one lady who I see regularly now. She's been coming to me since, must have been pre-COVID time. I was still working, like a lot of us. I started out and I was working in a room at home. And she'd found me. I was based up in Manchester. She was in Mid Wales. She found me online. She'd done a research. She was looking for somebody who was a medic. Found me online, booked in, and came to the house and came in. And she comes upstairs. She sat on in the room. Sorry, she came in, sat in the sofa, and she's looking around. You could see she was looking at my certificates and things on the wall, doctor this. And she inquired based on the fact that I was a doctor. So I thought, well, she wants a bit of reassurance. So I said, I said, one thing you've got with coming to a doctor is that I'm GMC regulated. Yeah. Essentially, if I do something unsafe or I'm negligent or whatever, you can come to me. You can go to the GMC and say, look, this doctor's doing this. I think you need to investigate. Yeah. And I said that to her. I said, they'll come and investigate. And if needed, they'll take my license off me. I won't be able to practice. And she goes, oh yeah, I wouldn't do that to you. That'd ruin your career. I was like, oh yeah. She was like, anyway, I know where you live now. I'll just come round. And I laughed, like going, oh yeah, it's just. And then she goes, well, I won't, but I know people who would. And I was like, oh, okay, right, that's I need to move out of working from home. And that actually was what triggered a lot of the expanse
my
the business because I was
gosh.
like, I need to move away from home. And I don't know if I'd have done that without that. But she's now genuinely one of my best, favourite clients. She comes in all the time.
That's actually a really funny story.
Still travels in from Wales. She's actually got a big house in Wales and she's got quite a few fields around it. And I've got a roof tent on my car. And she's like, whenever you're in Wales, come and stay in the field. So, like, genuinely, that's kind of the relationship I have with my clients.
Yeah,
and I just
that's
think
nice. It's nice when you make some genuine
But also, she was terrifying
friends.
to start with.
She's like low-key threatening you.
Yeah. I was like, oh, God, right, yeah, okay, better do this well.
Some people are so funny. You meet some characters, don't you, in this industry? You meet some characters, and I have clients now that I do class as friends because you get to know them. You know, you get chatting and you talk to each other, and it's like, wow, this is actually so nice because you kind of get to make them look good, you make them feel good, but then you also get this nice little relationship as well.
It's not something you do on purpose. It's something you do because we like it, because it makes our days better, and it's nicer for us. It also happens to be nicer for the clients. And I've heard more and more stories recently. I think people are looking for that because I've had more and more stories recently of people who've gone places, fairly high-end place that charge quite a lot of money. And it's, the person comes in, has a chat, but actually it's somebody else doing the consent form, somebody else doing the treatment. And they go, I don't like it. I like that personal touch. Like I don't know if you do, and I probably need to stop it at some point, but I might have someone doing Instagram and things for me, but I still do a lot of the messages stuff myself because
you need to keep some personalisation. Yeah.
And you know the clients, and you know that, they told you last time they've been on holiday. So you thought, oh, I'm glad I was on holiday.
If you
I'll
have
see you on
staff
Friday.
on messages, they can tend to respond very differently to how you would speak. And when you read it back, you're mortified because you're like, oh no, that was so-and-so and I wouldn't have said that. I would have said this.
All these treatments, they're expensive premium treatments, and you think people are paying to come and see. They're not just coming to get the Botox, they're coming to see you.
Yeah,
like,
and it's not a one-time treatment. It's something that you have to financially plan for to have forever, really, because it's something you have to keep on top of. So you're not just kind of treating on a one-off basis most of the time. I've never really treated a client just once. No.
They'll keep coming back if they're happy with what you're doing. I think it's all about building them relationships. Like, genuinely, like I've got
that's
so
nice.
many
I
people
like your approach. It's very authentic, and I think it's a lot more. I just think it's nicer, isn't it? It's just nicer
for everyone involved. For you and your clients, it's just nicer to be a nice, normal person.
Yeah, definitely. What would you say has been your biggest challenge that you faced whilst in aesthetics?
Probably a bit like everyone. You have that imposter syndrome thing. That was probably one of the biggest challenges to overcome. To kind of, I've been doing this for years, and for a long time.
I'm surprised that you had that, actually, because obviously with you being doctor, I'm surprised.
I think doctors have it. Like the first time you're in there and you're dealing with a heavy bleed or something like that after a delivery of a baby, and you're thinking, oh God, you can't let on that you're going, oh God.
Yeah.
Because you're the one, everybody's looking at you going, are you going to manage this? Or, but you still have a thing like, hang on a minute, I need a grown up. This isn't me.
Yeah,
like, why am I?
Yeah.
And the same with the aesthetics thing. When you, particularly probably for medics, I feel that a lot of us we can do the aesthetic side. I like to think I'm good at the aesthetics and the injectables and the treatments and things. I get good results from the clients. The business side I'm terrible at. The accountancy side I'm even worse at, and the social media side I'm slowly getting there.
Oh no, I think social media looks great.
It's getting there, but it's taken years and years to try and get there. And I think so. You get this imposter syndrome, thinking, well, I don't belong here. Everybody else is doing really well, and I think that's a big thing to overcome. And actually going, you know what? No, I am good at this, and my clients think I'm good at this, and I do belong here, and I should be talking to people like you on this, and I should be doing these things. And I think getting past that and having a bit of self-belief is really important. And that's what I struggle with a little bit, and I think a lot of practitioners do.
Yeah, and I think it's not spoken about enough. And I think because everyone shows the best parts of everything on socials, we get caught up in that, don't we?
Yeah.
And this is something I've really noticed actually with mentoring, because I have girls that come to me with huge followings that are very, very successful, and they come to me and everything's a mess. Because what they often tend to do is they come in from the beauty industry, they don't actually know how to run a business, but they're good at injecting. So they have the skill set there that makes them financially viable, but they can't actually run the finance side of it or the business side of it. So that all just gets left, and they have all this anxiety that obviously you would never see from a social media page. It just looks like they're smashing it and they're doing amazing.
Yeah.
But yeah, I would say that's a common
You think about it, most places, most industries, you try to do a lot of things as a one-man band often in this industry. So you're trying to, and people are good at different things. So you might be good at the injecting. That doesn't mean, and it usually isn't the case, that you're then also good at business and marketing and social media.
You've got to have so many hats, right?
Yeah. And it's not doable. You won't be good at everything. You've got to go, well, actually, you know what, I'll use my time efficiently because I'm the best at doing the injections. So you know what, I'll do that because actually the time I'm faffing around with Canva trying to make things, it's a waste of my time. I'm not good at it. It takes me 10 times longer than
I'm not
else.
good at Canva. I spent 2 hours yesterday trying to do a post on Canva, and I literally texted my manager and said to him, I don't know what this is, but this is not for me. I'm not doing this again.
No.
Because it was awful.
No. But then that's a waste of your time because in that hour or 2 hours you've done that, you could be doing treatments. And that's what I think I've started to learn as well now, is that I need to outsource them bits.
Managing your time effectively and knowing what to prioritise and delegating things that either you don't want to do or you can't do. And I always say, I think if things are on your to-do list and they've been on there for more than a month, chances are you're not going to do them. So just delegate it. You know,
you worry that it's like there's a financial implication to, like, you have to pay someone to do it, but honestly you could use that time much more efficiently if you focus on what you're good at. And you pay someone to do the other things. It'll come.
It's just about being smart, isn't it? But actually going, okay, this makes sense for me to do now because I can earn more money doing this, and other people can deal with these aspects. And I suppose that's what building a business is about. You never get a business where one person does everything. And I think people do look at this industry and think it's very glam. And it's just like this high life, but it's not. Like, how many times in the morning do you walk through the door and you've got 20 boxes of gloves and you're trying to carry your coffee? Oh yeah,
any of my clients will tell you the amount of times I have to apologise for boxes. I'm like, ignore the boxes on the landing, they're going in the car, I'm taking them recycling, just leave them there for now.
Yeah, it's crazy. I walk in with so many boxes. I've got my car keys, the box, the door key, and I'm like trying to unlock everything. And I'm just like, oh.
But do you think it comes down to people not know it? So I think there's, as well as this ongoing training with your students when they leave, you need to set those expectations and make it clear that that is part of it. Because I think they get very disheartened when they train and come out and then, you've taught them how to inject. They haven't got a clue how to make links with pharmacies. They haven't got a clue how to market themselves. They haven't got a clue how to think about accountants and things like that. Set up a business, set up a limited company. How do you do that? So I've had a few of my students I've done that with, and I know you do your mentorship thing.
The mentoring programs have everything in for this now because it's been a massive gap.
So much more important. So mine, I kind of decided to do it based on the fact that the amount of students who are contacting going, I don't know what I'm doing, not just injecting. I was like, okay, let's get this. So I've similar. Do you do yours for any aesthetic practitioner? Is that how you?
So we have. So basically, what my program is, it's 12 modules, but it's 12 modules of business related specifically to aesthetics that you need to know in order to run the aesthetics business. So that's how I structure that. That's all online, and I actually combine that with 4 1-hourly calls to actually set their targets and ensure that they meet those targets within a 12-week period.
So that's really in depth. I mean, I kind of looked at. I went, look, you've just finished your courses. What do you need to know? Like, what you've just finished your day 1 Botox training. What do you need to know? So I've kind of set up basics online course that you can join in and just basically go.
That's nice.
And so essentially everything's now branded. So now it's the Lord approach. Still getting used to the idea. Of the name.
Because it's the difference.
Essentially, I told you I don't like that. I like the Keiron, not the Dr. Lord. So now it's Lord approach. But essentially, it's what do you need to know? Not just about, I've taught you the Botox now. What are the other bits? Like, how do you get a prescriber? How do you affiliate with a pharmacy? How do you market yourself? What do you need on your social media? What do you need to set up a limited company? What is a tax deductible expense?
That's everything that's
things that have taken me 10 years to learn. I'm like going, I can tell you this in about a week, and I wish somebody had told me this in a week because it just makes setting it up easier. I think we work in these silos, and I think everyone's too defensive and don't want to share information with each other because they think, oh god, they're competition. It's not. Like, if we all back to the very start about this, medics versus non-medics versus this horrible bit in the industry at the moment, if everyone just works together and shares a bit of information and kind of you one big community, whether you're doctors, nurses, medics, non-medics, beauticians, whatever, it'll work better. But
Definitely.
everyone's very like,
Mm,
have you found no one wants to share anything with you?
It can be like that. This is why I really like Joe at Cosmedicheck. I really have a lot of respect for Joe at Cosmedicheck because they've set up a platform where they're actually checking people's certificates, helping them to know whether their certificates are accredited, and they're providing them with a platform that basically puts them in the right direction of the right people to know that are doing things ethically. So yeah, I think that it's coming on the rise, but there's only a few people at the moment that are putting the time in.
Needed.
Yeah, I absolutely agree. I think so.
Cesarean section 3 years ago.
Right.
And so when she was talking to me, she was like, she basically, she comes in, she goes, she booked in for a Botox. As part of the consultation, I was saying to her, are you pregnant? Any chance you'll be pregnant or breastfeeding? She goes, no, not pregnant or breastfeeding. She went, I've got 2 kids. One's 5, one's 3. Okay. She was like, in fact, she goes, you did my last cesarean section. I was like, oh, right. Like, that's, okay. And she goes, she said, yeah, when I was looking for places, she said, my husband was a bit funny about me having Botox and things done. And as I was researching places, I found you. And he's like, well, how do you know where you're going? How do you know they're going to know what they're doing? Like, what if they mess it up? She's like, he did my cesarean section and he delivered our child. I think he'll be fine.
I think he's competent
doing the Botox.
to do the Botox.
Yeah.
I would have loved to have been in the room when she had that conversation with the husband.
Being like, I think it'll be okay.
I think I'm in safe hands.
Yeah.
He delivered our child.
Yeah.
So what machinery do you have at the moment in clinics to assist your practice?
So I work in a few different locations, which makes some of the equipment a little bit tricky.
Okay.
The main thing I've got, which I can't believe I was without for so long, is I have an Ultra X ultrasound machine. It's tiny. You've seen them. They're sort of handheld machines, and they work through your phone, so you don't have to carry anything around. And it's just I don't use it for every client. It's more for if you're doing something complex like a nose filler, and you just want to check that the blood vessels are out of the way. Then it's perfect for that. Or if you're trying to dissolve some filler, the typical way, if it's an emergency, you kind of see that you've injected the nasolabial folds, you see that they've got some blanching somewhere, you think that filler could be anywhere along that course of that artery. You pop the ultrasound on, you put the Doppler flow on, and you can see the blood flow, and you can literally see where the narrowing is. You can watch with a cannula as you go in and inject your hyalase. So you're using less hyalase, and it's very targeted, and you can watch it in real time disperse and the blood come back to normal.
It's great.
Even elective reversals, if you're thinking, people, again, this pillow face thing.
Yeah.
Rather than flooding the face with
loads of hyalase,
which
destroying everyone's collagen.
Then you can literally target the areas with a cannula under ultrasound guidance. And it's just nice to have it in the room, even if you don't use it, just to know that if something happens, you can, or if you're in doubt, is that a bruise or is that
and you've got it there.
Just have a look, and then you can go home and you can relax.
Yeah.
Rather than thinking about it all night.
Yeah, because there's nothing worse than worrying after you've left clinic about a possible complication, right?
Yeah, so that's one. And all right, I've got my obs and gynae background, which means I can scan, but actually it's not difficult, and you can get all the training with it. And I think anybody really, they're fairly expensive bits of kit, but you'll wish you had one if you get an occlusion.
With the Ultra X, do you think that with regulation implications that Ultra X or a machine, of that kind should be mandatory? Or
I think it should be, or at least access to one should be mandatory. So if every clinic or every individual clinician doesn't want to buy one because they can be expensive, that's fine, but they should have affiliations with somebody who does so that they can be seen. You want to see the client quite quickly, doesn't have to be urgently. And really, as long as you can get your client seen within sort of 24 hours to a practitioner who has an ultrasound machine, especially if you've started the process, you've given them the first dose of hyalase, you've given them the aspirin or whatever you want to do, you've given them warm compress, and then you get them in the following morning to a place that scans. I think that's reasonable. I don't think it has to be on site. Yeah. But I do think it's definitely got value.
Okay. And do you use the ultrasound ever for pre-consultation?
Yeah. So I've got somebody coming in on Friday who's booked in purely because they've got quite a lot of fillers. She's only young, but she had a lot of fillers. They've migrated. And I think probably, I don't know what filler they've used, but I mean, she's 23, so it's strange to think she has so much filler that it's migrated. But she's going to come in for a consultation Friday. just so I can have a look with the scanner.
Amazing. And what a nice service to be able to offer somebody, to be able to actually say this is exactly where the filler is. And obviously, as you know, the more filler that we have, the more it pushes back.
Yeah, the more filler you have, and also the quality of the filler. So how many times do you do fillers for people and they've had fillers for 10 years and you go, okay, so what brand have you used before? And they go,
yeah, they don't even know what brand.
And you're like, okay. Or when you're giving them the consent forms and you're going through it and you're going, right, you've had fillers before, but I've got to do this anyway. So there's a risk of bleeding, bruising, infection, anaphylaxis, vascular occlusion. And you look back at them and you can see that they've gone white and you think, you've never had this explained to you, have you?
And they have no idea what you're talking about.
I really like sort of educating the clients on that stuff, and also on like product selection. So things like, your fillers. What does 0% BDDE mean? Well, actually, the fillers I use are 0% BDDE, so they are much more compatible with your body, much more compatible with your skin and your tissues. They sort of interact with your tissues in a more natural way, and they dissolve better. Yeah. The ones that have got the BDDEs in them, I think, but people don't know, so they just go.
They don't know. They don't even ask about the products. They have no idea about, like you said, that cross-linking anything. So I think, it's nice that you're, again, really personalised approach. Yeah, I think it's important.
They're not expected to know. People won't be expected to know. They don't know what the difference between one filler and another filler is. So actually, just being able to say to them, this is the reason I use it, and actually, it's not necessarily one of the major brands you've heard of. But I use this filler because I've used it for this many years. You can see all the pictures I've used. And this is the reason, because actually I've never had to dissolve anybody's filler that I've done for spread.
Okay,
like in good. 10 years, I've never had a single person come back to me and needs it dissolving because it's spread. I've had one dissolve because of fillers that I'd done on lips. And it was purely because I don't know what had happened, but I did. And I saw it on she sent me a picture and I was like, I need you to come back in. I'm not very happy. It was just like there was a bit of filler in the midpoint and I didn't like it, and we dissolved it. But other than that, that's it. Because if you do small amounts of filler, good quality filler with 0% BDDE, you're not going to have the complications.
Yeah, because you get the nodules and things with the fillers that have high BDDE levels. What is your filler of choice?
I use a couple depending on what I'm using. So depending on the area I'm treating. Yeah. Couple of my go-tos would be, firstly, Lumifil from Smile Pharma up in Warrington, a really great team up there. Have been really helpful actually with helping me do all my online training stuff. Great. So I've set up my online training platform, which was hard work. It's taken months.
Setting up online platforms.
But Smile Pharma at Warrington have really been helpful with their sort of products and also just kind of their ongoing support with that. But their filler, Lumifil, is really good. I've used Youth from Acre Pharmacy. Youth's a really good filler as well, really nice filler. Certain areas, no matter what you do, there's one go-to filler. So tear troughs, Restylane Classic. Yeah. It's just the only filler that's formulated in that way that you can put so superficially. It's not really, really soft, and it doesn't plump. Yeah. So it worked perfectly for tear trough. You can get it really superficially. Nice.
I haven't tried that one actually for under eye. I usually work with the Redensity.
Oh, yeah.
The Redensity.
I've used Redensity. I've used Restylane Classic just purely based on my preference. I use Classic. Okay,
but you said you place that superficially.
You can do both. It doesn't. The thing with Restylane Classic is it doesn't sort of finer fillers tend to plump, don't they? So like lips and things like that, and it's the last thing you want under there. But Restylane Classic doesn't attract a lot of water. It's just very, very mild.
Similar with the Redensity. That's why. Yeah, but I always place the Redensity onto the bone. I just think it sits better.
Either of those two are great, but I don't use anything else. Noses, I use Restylane Lift. I think again that's a similar sort of property. It's really dense,
quality products,
but it doesn't, and it lasts ages. I don't affiliate with one particular brand because I think it's worth shopping around for different types that work.
Yeah, and there's always new innovative products. What's your opinion on Juvederm?
I don't use it enough to be able to give a proper opinion. I've never particularly. I don't use it. I've got alternatives that I prefer. Okay. I'm not particularly, like I said, associated with one brand or anything like that. It's just what works well for me. I've never found a reason to use a Juvederm product over a product that I already use.
Okay, that's fair enough. It's nice to have, and there's a lot more new products that have been out since Juvederm, and I think it was more the older generation that were asking for Juvederm because it was kind of one of the first FDA approved fillers. Yeah. But I know very few practitioners that you know, that work
safety
with it.
profile and all the rest of it. Absolutely.
Yeah.
I just don't. You've got to see what the benefits are.
Yeah. And it's the composition.
Yeah. So why
like
would I
you
use
said.
that over the ones I'm currently using? Well, actually, there are reasons for certain fillers.
Yeah.
I just don't see it with Juvederm.
Yeah. Okay. Perfect. Should be close to wrapping up.
One thing Sarah wanted me to add to the equipment. Do you want me to do a bit? There's a new machine that I'm getting to do with the longevity side, so I'll just talk to you about that if that's all right, and then we can clip it in maybe.
Yes.
Let me just say it and we'll clip it into that.
Perfect.
And yeah, one of the other pieces of equipment we've got at the clinic recently, it's a little bit, it's brand new, it's not been announced yet, so it's all a little bit secretive. It will be coming out soon. I'm working with a company, it's actually an Italian company, and they've provided this machine for me. It's not really to do with the facial aesthetic side, it's more the longevity medicine, women's health and menopause management. So it's a non-hormonal treatment for menopausal symptoms. I've got a machine up in Cheshire in the clinic up there. A colleague of mine, Dr. Kai, has got her machine in Didsbury, and we're going to be taking them to London. We'll be the first people to
That's
have
really
it in London.
exciting.
I think there's one other person with one in Bristol.
Okay.
But yeah, it's really exciting treatment. It's kind of branching out from the aesthetic side a little bit more and incorporating a bit more of the gynecology background. But yeah, that should be
That's
that
exciting.
should be fun.
And you're one of the first with that. That's great.
So because we're working with a company kind of to introduce it. It's really popular in Italy. So
Italian companies are the best they're the best.
Yeah, it's just not made it over here as such yet, but it's I think a lot of my patients in the hospital and in you know, the ones I see in the longevity clinic, they want to avoid hormones when they can. They want to avoid medication, they want to be natural.
Yeah.
And this machine gives them it's really minimally invasive, very, very 15-minute appointments, very, very quick, very nothing, and will significantly improve symptoms of menopause without the need for hormones.
Well, I've absolutely loved having you on. You've been a joy to speak to, and you've been very informative.
Yeah, thank you for having me. I've really enjoyed it.
You're welcome. And who knows, Keiron might be on again later on in the year with more new innovative information. You know, I feel like you're going from strength to strength at the moment. There's a lot going on your Instagram. I see you're involved in a lot of projects, so who knows what this year holds for you.
Yeah, really looking forward to it. It's exciting. It's busy, but it's really exciting. And yeah, very happy.
You look very busy.
Yeah, but yeah, it's good though. I'm enjoying it.
Yeah.
And yeah, very happy. I'd thank you for having me. I'm very happy to come back anytime.
You're welcome. Thank you so much, and I'll see you on the next episode.